Hi, let's talk about drugs. So, in this lecture, we're going to talk about the medicinal drugs and the misused drugs. So, want to see what are the drugs and what do you mean when you say these drugs are for medicinal purposes, and what do you mean when you say that these are misused drugs? So, yeah, it's in this product again. Okay, let's first look at the definition of the word drug. So a drug is any substance taken into the body that modifies or affects chemical reactions in the body. So that's it. That's a simple definition of a drug. It's just any substance that is taken into the body so that it can modify or affect actually any chemical reaction in the body. Or a drug is any chemical substance that causes a change in an organism's physiology or psychology when consumed. So we are changing the way the drug is changing our perception of some other things. It's changing how different kind of reactions actually go or happen in our body. So the drug now may be taken legally to reduce a symptom, such as, for example, headache. Right now I'm having a mild headache, so I took Panadol just or paracetamol just to reduce this kind of symptom that I'm having, or to treat a bacterial infection. So these are medicinal drugs, but it could also be taken often illegally to provide a stimulation or induce sleep or create hallucinations and other things. So these are misused drugs. These are recreational drugs that are taken so that they can provide some stimulation, and mostly they are taken actually illegally. So yeah, we are in this lecture talking about these two kind of drugs: medicinal drugs and recreation drugs, or the misused drugs. Now let's talk about the medicinal drugs. So medicinal drug is any substance that is used in medicine to help our bodies fight illness or disease. So yeah, that's it. We are taking that substance in form of a medicine, as a medicine, to help our bodies to fight illness or any disease. So mostly such kind of drugs are known as antibiotics. So antibiotic is the ideal drug for curing disease, and this cures disease by chemically destroying the pathogen without harming the tissues of the host, for example our bodies. So most of the antibiotics we use, they do come from bacteria and fungi. For example, there's this drug streptomycin that is coming from streptomyces. This is a filamentous bacteria that resemble microscopic fungi. And also, for example, having a penicillin. Penicillin is coming from a fungus, penicillium. So yes, we're having these kind of microorganisms that help the human beings, that help us by trying to combat against the diseases, against the pathogens, against those kind of microorganisms that deal with our body, that harm our body. So they deal with these microorganisms but not harming the tissues or our cells. That's it. Now, antibiotics attack bacteria in a variety of ways. So some of them will disrupt the production of the cell wall. For example, having a bacteria, and then if we take in the antibiotic, it will disrupt the production of the cell wall of the bacteria, so thereby preventing the bacteria from reproducing or even cause them to burst open. Some interfere with protein synthesis, and thus arrest bacterial growth. For everything else like growth of bacteria, there's something else to do with protein synthesis. So yeah, these antibiotics can also interfere with protein synthesis and therefore arresting bacterial growth. Now there's one thing that you have to take note. Some animal cells, for example human cells, do not have cell walls. So the cell structures involved in protein production are very much different. As a result, antibiotics do not damage human cells, although they may produce some side effects such as allergic reactions. So these antibiotics disrupt the production of the cell wall of the bacteria. So because human cells do not have the cell walls, therefore they do not take part in disrupting the cell walls, or destroying the cell walls of the human being, because the human beings do not have the cell walls. Actually, the cells of human beings don't have the cell wall. They don't have walls. Don't have cell walls. They have cell membrane. So yeah, they only target the pathogens, for example, the bacteria themselves. So that's one of the things that you need to take note of that. Okay, but despite these kind of antibiotics destroying and having that kind of powerful machine to destroy this kind of bacteria that they are coming to us in form of pathogen, destroying our body system, disrupting the machinery production of everything else in our body. There are these resistant bacteria. So not all bacteria are killed by antibiotics. Okay, especially if a course of antibiotics is not completed. For example, some may stop taking antibiotics, so not all bacteria can be killed by antibiotics. So some of the bacteria are not killed, but are exposed to the drug. Okay, they're just, it's like, hey, you guys, you see this drug like this, so you have to take care of them. So you know, this drug, I mean this bacteria, it's like we are preparing them. Okay, we've shown them the drugs, and the drugs have not yet completed the work. The antibiotic has not completed its work of destroying this bacteria, so the remaining bacteria have been exposed to this kind of powerful drug. So you know, they now become resistant. Okay, resistant. These survivors may be drug resistant. They mutate. Okay, so when they reproduce, all their offspring have the drug resistance, so the antibiotic become less effective to defeat them. So for example, we are having one kind of bacteria that has developed resistance to a number of widely used antibiotics. We call it MRSA. So this is methicillin resistant Staphylococcus aureus. So these types of bacteria are sometimes referred to as superbugs because they are so difficult to treat. So this picture shows the scenario. We're having a bacterium here, it producing. We're having these two guys here, the offspring, and these guys are also producing this. Now we've shown them antibiotic destroying the whole of this line, but you know, due to mutation, this bacteria, this kind of bacteria is able to mutate and then produce other offspring that survive the powerful destruction or the powerful destruction or disruption energy of the antibiotic. So these are the survivors now. So this is a population of bacteria now all resistant to the antibiotic. So this is a very big scenario of that. Okay, so that's how you can see. So having antibiotic here destroying all of these guys here, but this is a mutation. Mutation has happened to this bacteria, this kind of bacteria, such that it has reproduced here, having this kind of offspring, and then we're having also all other offsprings here. So yeah, that's kind of resistant bacteria. Okay, now some may wonder, may ask, antibiotics and viral diseases, why are antibiotics not effective against viral diseases? So the issue here is the structural and functional differences. Let's have a look at here. Have a look of a bacterium, and this is a virus. So if you see this is a bacteria. As I said, have a flu. So yeah, bacteria here has bacterium has a cell wall. Okay, cytoplasm, whatsoever, you know, such kind of thing that this bacteria have. So this is one kind of bacteria. Okay, so here we're having the virus. Virus is having a RNA strand here, protein code, and capsule layers. Yes, but why are antibiotics not effective against viral disease? So you know, it's because antibiotics work against or work by disrupting structures in bacteria, such as, for example, cell walls and membranes, or processes associated with protein synthesis and replication of DNA. So you see, viruses have totally different characteristics to bacteria, so antibiotics do not affect them. But specifically, viruses are surrounded by a protective protein coating, so they don't have cell walls that can be attacked by antibiotics like bacteria does. So it is because of this that antibiotics don't work on the viruses. So it's because of the protective protein coating that these viruses have, because they don't have cell walls that they can be disrupted by these antibiotics. That's why those bacteria that have cell walls are very much highly attacked by the antibiotics. So yeah, That's a very good reason. Okay, so let's that was a part to do with the medicinal drugs, but let's go to misused drugs. uh you know, we're having the drug epidemics of the decades. So 1970s, people were using these. 1980s, 1990s, people now like smoking, but taking in the deep breath of these kind of issues. And they're having 2000s and 2010s now. They're using the simplifying all these kind of drugs into tablets now, so that we can just take one tablet and then yeah, like that. So drug misuse, or those drugs that are misused, so this is the definition of it. Drug misuse is defined as the use of a substance for a purpose not consistent with legal or medical guidelines. So this is a definition coming from WHO 2006. They defined a drug misuse as the use of substance for a purpose not consistent with legal or medical guidelines. So yeah, so it involves taking the incorrect dose, taking the drug at the wrong time, forgetting to take a dose, stopping the use of a drug too soon, taking a drug for reasons other than why they are prescribed, and taking a drug that was not prescribed to you. So a lot of things involved under a drug misuse as a process. So classifications of so many drugs. The misused drugs, they are in form of stimulants, whereby medications that increase alertness, they may be taken to increase alertness, so that they can be people can be energetic, okay, attention, energy, blood pressure, heart rate and breathing rate, so that they can do maybe a certain kind of work. So they are taking those drugs, they can so that to change the normal body condition. Yeah, so therefore there can be short-term effects and long-term effects of that. For example, in short-term effects, they can increase alertness, the attention, the energy, they increase the blood pressure and the heart rate. But long-term effects, we can have heart problems about that, the psychosis, the anger, the paranoia. All of these can have can be the long-term effects of these stimulants. So you really need to make sure that whenever you're taking them, you have to know, to have that kind of knowledge of the long-term effects. There are those that are known as depressants, central nervous system depressants. They are medications that slow brain activity, which makes them useful for treating anxiety and sleep problems. So yeah, we have such kind of things. Hallucinogens, for hallucinating things, substances that distort the perception of reality. So yeah, having those things. For example, alcohol is also another common drug, cocaine, heroin, and other things. So yeah, we're having methamphetamine and marijuana, opioids, all these things, pain relievers. Yeah, we're having a lot of them. Yeah, opioids can cause euphoria and also are often used non-medically, leading to overdose or overdose deaths. So yeah, we're having them, a lot of them, but the most common ones are we're having the alcohol, cocaine, heroin, stimulants, all those kind of stimulants people use for them to be energetic, the depressants whenever they need to sleep, whenever they're treating anxiety. These are very much common. Yeah, so that's how you can have such kind of outline of what are these recreational drugs, what are these misused drugs, and what it means when you say we are misusing a drug, and yeah, and the like. So in this lecture we've looked at some of the things to do with the drugs. So having the medicinal ones, and having the misused ones. Okay, so these are additional explanations on the narcotics. About that, you can have, if you download this, you guys, you can have to look on the other things. So whenever I talk about alcohol, we include the wines, beer, spirits. Okay, all these are depressants of the central nervous system. So small amounts give a sense of well-being with a release from anxiety and the like. So people feel good whenever they are taking them, but remember that there are long-term effects that affect the central nervous system, and then they may also lead to death and the like. So and may cause some of the things, for example, smoking. Right, I've taken smoking as one of a dangerous thing. You have to smoke at your own risk. Having it can cause lung cancer, So we're having carcinogens that are in cigarette smoke, such as tar. They increase the risk of lung cells becoming cancerous. For example, tumors develop. So these are balls of abnormal cells which do not allow gaseous exchange like normal lung cells. So you know the gist about the cancer. It has killed so many Americans, people all around the world. People like smoking and the like. So yeah, we're having the COVID, chronic obstructive pulmonary diseases, emphysema. This is a breakdown of the gas air sacs. These are known as alveoli. Chronic bronchitis. The smoke stops the cilia in the air passage in the bronchial from beating. So irritant substances in the smoke and the excess mucus collect in the bronchi. This leads to the inflammation of the bronchial, known as bronchitis. Having coronary heart disease, it results from a blockage of coronary arteries by fatty deposits. So yeah, this is also a common disease, coronary heart disease. So these are some of the things that you can get, or the effects you can get from smoking. There are a lot of them out there. So yeah, that's all I had for this I don't know, a lecture, a lesson, presentation, whatsoever. But I think you guys, you learned a lot from this, and also it can help you in your own exam if you really careful, study well. So yeah, all the best wherever you are, and thank you for having time to check a little bit about this kind of lesson of the drugs. Please subscribe and like and share, tell others to tell others. Have a good time.